Welcome to parenthood. It's a momentous occasion, filled with anticipation and dreams for your little one. A journey full of joy, wonder, and, yes, a few surprises along the way. Get ready for countless smiles, heartwarming cuddles, and the occasional sleepless night. One of the first hurdles many parents face, and it's a very common one, is nappy rash. It can be a bit unsettling to see your baby uncomfortable, but rest assured, you're not alone. Nappy rash, also known as diaper rash, is a common skin irritation. It's something most babies experience at some point. That appears under your baby's nappy, in the area that's in direct contact with the diaper. This area is particularly vulnerable due to the constant moisture and friction. The skin may look red, often the first sign that something is amiss. Sore, puffy, indicating inflammation and discomfort for your little one. Or even have small spots, which can sometimes resemble tiny pimples. It's absolutely not a sign of poor parenting, so please don't feel guilty or inadequate. Just a normal part of babyhood, a common skin condition that almost every baby experiences to some degree. The rash can be mild, barely noticeable, with just a hint of pinkness, or cover the whole nappy area extending to the creases of the thighs and buttocks, making your baby fussy, especially during changes, as the area is sensitive to touch. Think of it like a mild sunburn on delicate skin. It's uncomfortable but usually manageable. Baby's skin is incredibly sensitive and constantly exposed to moisture from urine and feces, as well as friction from the diaper itself, making rashes common. It's a perfect storm of factors that can irritate their delicate skin. The good news? There's plenty you can do about it. Nappy rash is rarely serious and usually easy to treat at home with some simple remedies and a little extra care. With gentle care, frequent changes, and the right approach, most cases clear up quickly, bringing relief to both you and your baby. Millions of parents deal with this every day. You're not alone in navigating this common challenge. The key is knowing how to manage and prevent it, understanding the triggers, and implementing effective strategies. This guide will give you clear, practical steps to help your baby, providing you with the knowledge and tools you need. By the end, you'll feel confident in handling nappy rash and equipped to keep your baby's skin healthy and happy. Let's start by understanding why it happens so often, delving into the underlying causes of this common skin irritation. We'll break down the causes and solutions together, empowering you to take proactive steps in caring for your baby's delicate skin. Have you ever wondered why babies seem so prone to developing nappy rash? It can be distressing for both baby and parents, but understanding the reasons behind it can help you prevent and manage it effectively. It's all about the unique environment created inside the nappy. This enclosed space, while necessary for hygiene, presents a specific set of challenges for a baby's delicate skin. Nappies are essential for keeping things contained and preventing messes, but they also inadvertently trap warmth and moisture against a baby's delicate skin, creating a breeding ground for irritation. This warm, humid environment can quickly compromise the skin's natural barrier. Baby skin is significantly thinner and much more sensitive than adult skin, making it more susceptible to external irritants. This delicate nature makes it incredibly easy to irritate, leading to redness, inflammation, and discomfort. The main culprits behind nappy rash are moisture and friction, a troublesome duo that constantly challenges the baby's skin. When skin is constantly wet, it softens and weakens, losing its natural protective properties. Simultaneously, the nappy rubs against this weakened skin, causing friction that further breaks it down and compromises its integrity. Now, add in urine and poo. These waste products are full of chemicals and enzymes that can be incredibly irritating to a baby's sensitive skin. As urine sits in the nappy, it begins to break down and turns into ammonia, significantly changing the skin's natural pH balance and making it even more vulnerable to damage and irritation. Feces contain digestive enzymes that, with prolonged contact, can actively damage the skin's surface. And when wee and poo mix together in the confined space of a nappy, irritation is almost guaranteed, creating a perfect storm for nappy rash to develop. It's important to remember that it's not necessarily about the nappy brand you choose, but rather the overall conditions that prevail inside the nappy itself. Understanding these factors helps you see that nappy rash is often a predictable consequence of the nappy environment, and definitely not a reflection of your parenting skills or care. It's not your fault. Therefore, prevention is primarily about proactively managing this tricky nappy environment to minimize irritation. Next, let's delve deeper and look at what specifically triggers a rash, so you can be even more prepared. Beyond the nappy environment, certain triggers make rashes more likely. Not changing nappies often enough exposes skin to moisture and irritants. Diarrhea or frequent stools can quickly worsen irritation. New products, wipes, nappies, detergents, may cause reactions. Introducing new foods can change poo and trigger rashes. Sometimes, a rash gets complicated by a fungal or bacterial infection. Spotting these triggers helps you act fast and prevent problems. Prevention is easier than cure. Keep your baby's bottom clean and dry. Change nappies often, especially after a poo. Use plain water and cotton wool or gentle, fragrance-free wipes. Clean all skin folds, then pat dry, never rub. Give your baby nappy-free time to let skin breathe. Apply a thin layer of barrier cream with zinc oxide or petroleum jelly at every change. Make sure nappies fit well, not too tight. These habits form a strong defense against nappy rash. Consistency is key. A few simple steps can keep your baby comfortable. Let's talk about what to do if a rash appears. If nappy rash appears, don't panic. Most cases are mild and treatable at home. Change nappies more frequently and give extra nappy-free time. Clean gently with cotton wool and warm water. Avoid wipes if they sting. Pat the area dry, never rub. Use a thick zinc oxide-based nappy rash cream on the red areas at every change. Avoid products that might irritate. Stick to basics. Skip plastic pants as they trap moisture. With gentle, consistent care, most rashes improve in a few days. Be patient and diligent. If things don't improve, it's time to seek help. Let's cover when to call a professional. Your baby's comfort is the goal. Most nappy rashes, thankfully, clear up with simple care at home. Often, a little extra attention and the right products are all you need to see improvement. But sometimes, despite your best efforts, you need expert help to get things back on track. It's important to know when home remedies aren't enough. If the rash doesn't improve after 3 to 4 days of consistent and careful care, it's time to consider seeking professional advice. Don't wait too long, as some conditions can worsen quickly. In such cases, see your GP or health visitor. They are equipped to assess the situation and provide guidance. Beyond the duration of the rash, watch carefully for specific signs of infection. These indicators can signal a more serious problem. Be alert for a bright red rash accompanied by white spots, which could indicate a fungal infection. Also, watch out for yellow blisters, which are another sign that the rash may be infected and require medical attention. Pay attention to whether the rash is spreading beyond the confines of the nappy area. Expansion can be a sign of a worsening condition. The presence of a fever or any broken skin due to the rash warrants immediate attention from a healthcare professional. If your baby is exhibiting signs of severe pain or discomfort, this is also a red flag that should not be ignored. If your baby is unusually distressed, more fussy than normal, or inconsolable, it's a clear sign that something is wrong. If you notice that the rash is bleeding, this is a serious symptom that requires prompt medical evaluation. In any of these concerning situations, don't hesitate to get medical advice as soon as possible. Healthcare professionals are trained to accurately diagnose the cause of the rash and prescribe the most appropriate treatment for your baby's specific needs. This might include an antifungal cream to combat fungal infections, an antibiotic cream to address bacterial infections, or, in some cases, mild steroid creams to reduce inflammation and promote healing. Ultimately, trust your instincts as a parent. You know your baby best. If you're worried about your baby's rash, always seek help from a medical professional. Remember, there's no such thing as a silly question when it comes to your baby's health and well-being. Acting early and seeking timely medical intervention can often prevent more serious complications down the line. You are your baby's best advocate, so don't hesitate to seek the care they need. Nappy rash is common and not a reflection of your parenting. You now know what causes it, how to prevent it, and how to treat it. This knowledge gives you confidence and control. Every challenge, like nappy rash, is a learning experience. Trust your instincts and be gentle with yourself. You're equipped to keep your baby comfortable and healthy. Remember, you're not alone. Millions of parents have been here too. Stay patient and consistent in your care. Enjoy the precious moments with your little one. You're doing a wonderful job.